Hi, this is Bill Mobley for the Sanford Institute for Empathy and Compassion. And this is the Compassion Beyond Borders series where we have a chance to talk with really remarkable people across the world. People who make a big difference in other people's lives by serving them and doing so sometimes under very difficult circumstances. For example, during the pandemic that we're all experiencing. These are people who face challenges every day, who make extraordinary efforts to deal with those challenges. And because of what they do, they bring hope to the lives of very, very many. My co-host, Naila Chowdhury, is Director of Social Impact and Innovation for the UC San Diego Extension Division. And so, Naila, if you'll introduce our guest, I'd love that.
Absolutely. Thank you, Dr. Mobley. I want to extend my heartfelt gratitude and respect to everyone working in the front line. Today's guest is Runa Khan from Bangladesh. Both the person and the country holds a very special place in my heart. Runa is an Ashoka Fellow, a global change maker, and a Schwab entrepreneur, and also a Rolex laureate. She's the founder and executive director of Friendship and founder and co-chair of Friendship International, which is in 5 European countries. She and her team directly serve 6.5 million lives a year. They're working towards saving lives, creating sustainable solutions, and bringing hope and dignity to each life they touch. Runa is an embodiment of love, empowerment, and compassion. Hi, Runa. It's such a pleasure to welcome you. Thank you for being with us.
Thank you very much, Dr. Mobley, Naila. I'm very happy to be with you because, when I heard of your center, of compassion, it has been, I think, the first reaction of the way that I work. It's intuitively, for me, that is what sparks the way that I work. And so when Naila told me about your center, I was very happy, to be in this program with you. Thank you.
Thank you. We are very eager to hear your awe-inspiring life's journey, your challenges, and your work with Rohingya camp and your floating hospital. So, and especially now the social impact of COVID-19.
Thank you, Naila. I started in 2002, and it was really, I took a leap of faith, in creating the first mobile ship hospitals in Bangladesh. Bangladesh is a country which is, it's a country of 1,000 rivers. It's a country where the rivers can be 30 kilometers broad, and first impact of climate change has been happening in these places. And I remember going to these islands, which are called chores, and seeing the condition of life there because people somehow found it too difficult to reach these millions. And I remember a woman coming to me with a child, who had cerebral palsy, and thinking I'm a doctor, saying, everybody told me that this child can't get cured. Do you think I should kill this child? I've seen families who had not eaten for 2 days, and you can think about it, but when you actually see them, it's a total different ballgame. I have seen people standing there with the lands breaking away in the floods, and everything washed off, including hope that they can restart their lives. And I come from a privileged background, but I knew that I had to do something, and I knew that I could do something, even as everybody said, it was just a drop in the ocean that I would be doing, because I had no idea what is development work. I didn't know what an NGO stood for. I had never been inside a hospital operating theater. I had never been on a ship, and I wanted to take this ship and go to this remote area to serve the communities simply because I found them suffering for basic lack of healthcare. And, you couldn't watch because you cannot stand there as a human being and watch this happening in front of your eyes, knowing that you can do something. And this realization that you can at least touch that one life, this realization leads to a responsibility. And it is on this responsibility that I started Friendship. And it kind of grew in a sense that my goal was not to make a big organization. It was just to touch lives, touch it effectively, so that these people who were suffering didn't become a statistics of death in this country. And so I started the first mobile ship hospitals. I would carry these to the doorsteps of the people of these islands because there were millions. It was not 1,000 people, they were in millions. And because these people did not even have money to cross the island and go to a healthcare service or to access any basic service. And somehow I realized that in spite of having this ship with these operation theaters, international doctors, local doctors, we were doing all kinds of reconstructive surgery, orthopedic surgery, dental care, eye care, cervical cancer, right at the field level, awareness. It was not enough. Because once I found a child who had cerebral, a child who was burnt, and he cried for 3 days, not even having a paracetamol on that island. And I realized that no one should fall through this gap of pain. And I started this 3-tier healthcare system. And, when you are at the ultra poor level, Bangladesh is a country which is one third the size of California, approximately, 4 times the population. And it has, and 45% of that population is below the poverty line. So we had dimensions to deal with which were very difficult. And people needed education, they needed access to service. And one by one, according to the needs, I kept filling in the blank gaps. And you need to listen to what they need, and then you need to listen also to what they don't say. Because in that, what they don't say is actually the truth. And we needed to identify those. And today we are working with saving lives, poverty alleviation, climate change, because these are the areas which are most impacted by climate issues. And of course, empowerment, because that is what gives them the platform from which they can take off.
Runa, if you could tell us the present condition and how you're working towards COVID-19 and your preparedness with the camp, Rohingya camp.
Thank you. With the COVID-19, it's an international crisis. We've never seen this, and Bangladesh, being with 160 million people, and it's you can understand that it has been a challenge for the government, but Friendship, for somehow, we started working on it much before it was declared. And we started partnering the government with health. We only have 1.1% of our staff who's not attending or who's not working. Everybody in the field. Our hospitals are working. Our awareness programs are going on. We are in a huge, our empowerment program with women in the field. They're making masks. We are working with the government even for swab collections and, for testing. So we are actually, of course, relief work. We are doing, livelihood has been a big issue because there are millions of people who are not getting food with this lockdown, which is happening, and isolation. So we are, of course, providing food, seeds, because tomorrow is not going to wait. They need seed to plant. And so we are giving that. It is something which has touched everybody. And for this world of ours, if it can teach us a bit of humility, that we are just guests on this planet, that for tomorrow we can bring this, the sense of more equality is needed because nobody is isolated. The sense of solidarity needs to be brought into the world. This love that we are in this planet with the stars, with the, we watch the stars together, we see the earth, we see the plants, we see the animals. We are also just guests of this world. And we need to be able to, bring out a better world for ourselves only if we can work with respect with nature. And we need to, human greed is something which needs to be controlled. We mustn't want our 24th bag and our 26th, jewelry. This needs to be controlled, because otherwise I do not see how, without having this deep change happening in the human soul and spirit, that we can deal with things like this happening to our beautiful world, every year. We cannot have this.
Social isolation is a luxury in Bangladesh with the Rohingya camp, where there's only a thin plastic sheet in between families and their homes. So how are you doing this planning of like keeping them safe or teaching them the method of keeping away? It's impossible, right? There are millions of people in the camp.
So, disaster, we are in the front line of disaster for the last 18 years. My staff has has brought down children from trees, when they were caught in tornadoes and cyclones. But we are used to disaster. We deal with it. But when the Rohingyas came in, it was totally different. It was totally different because we could not afford to get, we had somebody to get angry on. We saw the fires burning on the other side in Myanmar, with people coming on, children. One man comes with the two kids who were just born, doesn't know what to do, raining, storms. And our staff, I had to control my staff. And I told them that, this time you have to be very careful because you have to take control of your own emotions before you go to the field, because you can't, all the time you couldn't get angry with God. Now you're going to get angry, and it mustn't, make your ability of not performing. And millions of people, we were there right from the beginning, millions of people coming in, and 1.2 million over the, a few months. And what disturbed me very much was everybody was putting up banners, international organizations, local organizations, they are working. And I decided to work without any banners. Friendship would be invisible. What we did, the people would be the witness. And if we were good, I was confident it would work. And today we are the second biggest, largest national NGO working in the camps. Healthcare, we have healthcares in 11 camps. We started the first, the host come host come Rohingya population coming for comprehensive clinics, operations going on. We put in our mHealth modality in the fields. We did, health, education. We've got now, I think, about 220 schools there. And so we needed to work, but, we needed to work with a lot of understanding, that these people in Bangladesh that we were dealing with had the dignity of calling Bangladesh their home. But these people had nothing, not even the soil they were standing on. And for me, I needed to work with them with quality, so that they felt dignified. So that, and I remember going to one of our schools, and the children had put earth on their face because they were used to putting this, this particular kind of a thing on their faces in Burma, and they were just taking earth and putting it on. And this, it broke my heart because they wanted some touch with, who they were. And this is what we have been striving for ensuring that these people, that the Rohingyas who were there we could work with them with a lot of, ensuring that they don't lose their hope. And it has been a challenge. It has been very difficult because there were a lot of organizations there, each having their own mandate. But I just kept, let us do the best that we can with the money that we've got, ensuring that these people are not humbled.
Runa, it's an amazing story. So the themes that come through your story are 1,000 rivers, a floating hospital, and a person who was born into privilege, but then confronts the reality of each person one by one, the reality of their difficulties. And so it sounds like the formula is to listen to what they really need one by one, to respond to that one by one, but to allow that to just multiply to this bigger effort that you're involved in. How do you manage on a daily basis to deal with all this suffering and at the same time keep such a very positive attitude?
Because, when people ask me what I find most difficult is to make that one-to-one decisions. This child needs a heart transplant, and that is one price. And I have, 5,000 women I can do maybe fistula operations for, with that price. How do I make this decision? Even today, that is the most difficult decision. And I cannot as yet give it to the people who are working with me to make that decision. But what keeps me going is not only the people that we are serving, and and the change that happens in their lives, every life we touch, but also this group of people who are what you would call colleagues or staff. And this was not easy because humanitarian organization needs a humane way of dealing with everybody, from the beneficiaries to my stakeholders to the people who are working with me. Every decision I make has to be based, on this compassion, this empathy. Otherwise, it's not possible to have one rule for one and another rule for another set of stakeholders. And I think this has what led to friendship being what it is, because from a boatsman who I take 14 hours to reach in one end of the country, to the doctor who's leading 300,000 people who he's serving every month for medical health, both of them, they understand what friendship is, where we are striving to go, what is the vision. And for me, I think this passion somehow, because it's a very realistic passion, it's not words. Everything we do, it kind of, there's an action which is happening behind it, and it creates that change. And I think this verity is what makes people believe and buy in. And it's not only people working for friendship as staff, but also my international colleagues. I have the most amazing set of people, who support and help me, and who believe in friendship, and who believe in the way that there is something beyond just statistics, data, and money, And I think this is what keeps me going. It's the people. It's always about the people.
You must have people say how very grateful they are to you for the work you do. That has to be a big reward for you. I would think that would be very, very helpful.
I don't want people, especially my beneficiaries, to be grateful to me. Because if they are grateful, then they cannot have the pride and dignity to stand on their feet. So I don't want them to be grateful. I want them to understand that this is their right. The healthcare which others can't provide, we are providing it, and we are honored to provide it. And this is, every action that we do, we try to embody this, in the people. And it's very important for me because, I don't want gratitude. I want these people to stand on their feet, to be able to take off, to have equality in this world we so need.
Well, we want to say how grateful we are to you for the work you do and for the amazing experience that you have. I know that dignity is just a part of every person's right, and I agree with you on that. But it's also really wonderful for the people who've received help, even though they deserved it from the beginning, to say about people like you what a huge difference you're making. I think we could say that Runa makes hope float. And we're very happy that we were able to have you on the program, and we wish you very well. And if there's anything we can ever do, please let us know. Runa, thank you so much.